Very pleased to say the new Health Secretary, Sajid Javid, joins us on the programme. Mr Javid, very good morning to you, and of course, congratulations on your return to Cabinet.
Good morning.
But what a job you have to do. I want to start, if we can, with perhaps one of the measures which has caused a little bit of debate, as announced by the Prime Minister yesterday. Face masks. Yes or no, are face masks effective in reducing transmission of COVID-19?
Well, now, if I can explain, we need to learn to live with the virus, and that is why yesterday I set out how we plan to ease restrictions from July the 19th, providing the tests that we've said are met. And the reason we can afford to do this, which is to move from a system of rules and regulations, including rules we currently have on face masks, to a system of guidance and personal responsibility, is because of the vaccine. The vaccine is working. It is our wall of protection. Jab by jab, brick by brick, it has provided us with this protection, which means that although case numbers are high, and as I said yesterday, I expect them to go far higher, what we are seeing is a severe weakening of the link between case numbers and hospitalisation and deaths. And that is what is allowing us to ease the restrictions in this way. So to turn to your question about face masks, that's why we can make this change and move to a system of guidance.
But as you say, it has severely reduced the link between infection and death, but it hasn't broken it. And it follows, of course, that if we are going to see, as you just put it, a very significant rise in infections, there will be a concomitant rise in death. So again, the question I did ask was, are face masks effective at restricting the transmission of COVID-19? And if so, why are we stopping people wearing them now?
Well, in terms of coming to the decisions that were announced yesterday by myself and the Prime Minister, of course, we've taken the best possible public health advice, scientific advice. We have the best advisors in the world. And together, looking at the impact of the vaccine and the severe weakening of that link, we, of course, are very comfortable with the decisions that were announced. Now, I fully understand why many people will be anxious. They'd want to be cautious. And that is why other protections remain in place. But the vaccines are working. And if I can just quickly share an example of why I'm saying that, is that at the moment, in the last 24 hours, we're getting case numbers around over 25,000 a day. But when you look at hospitalizations and deaths, deaths, for example, are 1/30th of what they were the last time we saw case numbers of that type. And also, when we're thinking about our health challenges and health problems, one of the things I tried to set out yesterday as well is, as Health Secretary, I'm also very concerned about all the non-COVID health problems, which, they haven't gone away, and if anything, they've got a lot worse. The waiting list has grown dramatically. It's going to grow a lot more before it comes back down again, sadly. There are many people that have not come forward with cancer problems, with heart disease problems, with mental health problems, and I'm very concerned about that too.
Minister, I completely understand that. I'm not going to ask the question again whether or not face masks are effective, because we know that they are. In the latest meta-analysis that came out in the last 24 hours, 6 million individuals involved in it, shows that it reduces transmission by at the very least 25%. So I'm just wondering about this shift that we have seen between last Thursday and yesterday evening, in which, we're not being told what to do anymore. We're being given personal responsibility to make our own decisions. So on that basis, in which circumstances will you be wearing a mask?
I'll always, for the foreseeable future, I will be carrying a face mask with me. I think that's a very responsible thing for anyone to do. As I've said, the pandemic is not over. And if I'm in a crowded or enclosed space, I will wear a face mask. In fact, I'll wear one if I was next to someone or near someone that felt uncomfortable with others not wearing face masks.
So that's the point.
And that's what I mean by personal responsibility.
Yeah, but also, we learned this morning from the papers, and in fact I've stood it up myself, government advisors have been briefing out this morning that vulnerable people who may well be concerned about travelling on public transport, given that many people will choose not to wear a mask, you've given them the opportunity to do so. The advice from government for vulnerable people, people with maybe suppressed immune systems and so on, is to travel outside peak times. So we're telling people who perhaps have received a cancer diagnosis that they will have to take a bus at 5 o'clock in the morning. That's what this government means by personal responsibility.
Well, I've given an example of when I would wear a face mask, and I hope other people would do similar. But again, to turn to your particular question on face masks, why can we move from a system of rules and regulation to guidance and personal responsibility? It is because of the vaccine. I mean, the vaccine is working, and the fact that now we've got the most successful vaccine rollout program in the world, thanks to the NHS and our scientists. What we have is a situation where I think some 4/5 of adults have had at least one jab, some 3/5 have had 2 jabs, and we've announced recently our plans for a booster program in September. And the purpose of these vaccines is so that we can slowly start taking our freedoms back. People do want to see a return to something that looks more like normal. Of course, there are still other protections in place. For example, the border controls. We're going to have a more proportionate and balanced test and trace system. And so there are other things that will continue to protect us. But the most important thing is the vaccine. And I would urge everyone to make sure that they're jabbed up.
Strangely enough, I'm off for my second jab later on today, so the advice is well taken. But just
Good.
in terms
Good luck with that.
Thank you. I suspect I might need it getting up at 2:30 tomorrow morning. But just in terms, though, of where we go next, I mean, you yourself have conceded there will be additional deaths. Increased infections means increased deaths. I'm wondering if we can get a figure, what would be an acceptable excess mortality rate from COVID-19 as we move forward?
I have to say, it's not about something, some number of deaths being acceptable. Of course not. What we are seeing is that with rising case numbers, and yesterday I said we could see a doubling of case numbers by the time we get to July the 19th, we are not seeing a corresponding increase in hospitalizations and death numbers. And that is because the vaccine's working. That's what the vaccine's for. And we can't live in a world where the only thing that we're thinking about is COVID and not about all the other health problems, not about our economic problems, our educational challenges. And we have to make use of a vaccine that is thankfully working and be aware of all the other health problems I've just mentioned a moment ago. But as Health Secretary, I tell you, when I came into this department with a fresh set of eyes, it is shocking when you look at all the other health problems that have built up. Some 7 million people have not come forward during the pandemic for help from the NHS with their health problems. 7 million people. Now, just think about all the health problems that have been stored up, and we need to treat that as a priority too. It cannot just be about COVID.
Sure, indeed. And as you mentioned, the fresh pair of eyes that you bring to it, I mean, it has to be said, your approach, that which we heard from you yesterday and the Prime Minister, is a country mile away from what we were hearing from the previous Health Secretary. You have to concede that it is a different approach, and that, frankly, if Matt Hancock had remained in post, we probably wouldn't have had an announcement of the type that we had yesterday. So I'm just wondering what has changed. I mean, the sage advice has remained the same between Thursday and today. The advice in terms of the data set has all been going in exactly the same direction. To my mind, the only thing that has changed is that we all had to swallow a gallon of mind bleach after we all got to see the former Health Secretary grabbing his aide's backside. I mean, where is the science that has led us to making this fairly fundamental change in approach?
I think what's changed since this pandemic is obviously we've learned a lot more about the virus itself, and I've said a lot about the vaccine, but also it's worth mentioning the treatments are much, much better than they were at the start of this year. One of my first visits, I think on my second day on the job, was to St. Thomas's Hospital, and I went to see the doctors and the consultants in the wards where they were previously treating hundreds of COVID patients, and now at the time I went, there were hardly any. But what they also explained to me was the impact of the drugs, the treatment that is now available, especially dexamethasone, and that's important too. So that's something that's changed since the pandemic. But most of all, what's changed, and again, I have to come back to it is the vaccines. They are working, and it is allowing us to take the measures that we announced. But let me say again, I absolutely can understand that many people will be cautious, they'll be anxious, they'll be concerned. I absolutely get that. The Prime Minister does, my colleagues throughout government government do. But we have to take advantage of the vaccines and the protection they're providing, how they have severely weakened the link between cases and hospitalisation. And no one's pretending here that this has all happened before somewhere and there's a risk-free way out of this. We haven't pretended that in past pandemics they've been very different, and so we have to learn as we're going along, but we're getting the very best advice that there is available in the world from the best scientists in the world, and together with their advice we're moving ahead.
Do you understand why some people found it curious to hear the Prime Minister, speaking from Downing Street yesterday, lecturing us all not to be demob happy on something that this government has become very fond of describing as Freedom Day?
I didn't quite get the question. I'm sorry, you cut off.
Sorry, I'll repeat it. Do you understand why some people find it curious that the Prime Minister told us all yesterday not to be demob happy, to go wild, to enjoy ourselves too much on something the successive government ministers have been happy to describe as Freedom Day?
Look, I think that what the Prime Minister is reflecting there is that still advising people to take notice of the guidance and to emphasise that we expect and hope people will show personal responsibility. And I know people will. If you look at the huge efforts that the British people have made during the course of this pandemic, obviously not just following rules, but just taking a more common sense approach to social interaction, for example, that is what I think will continue. And I think that's what the Prime Minister is emphasising, and that's something that we'd all like to see.
Just in terms of what might happen later on in the year, we heard, of course, from Chris Whitty, the Prime Minister, and yourself have all said that winter may be difficult for the health service. On that basis, can we just be absolutely crystal clear? The government retains the power to reintroduce restrictions later in the year if necessary, if, as I'm sure you would say, absolutely necessary.
Look, one concern that is still there, and this is throughout the world, is that there will be new variants. I think no one can rule out there won't be further variants of COVID, and no one will know what they will look like. There is a risk, and I think it's a real risk, of some kind of vaccine-resistant variant. There's no sign of that yet anywhere, but I think it's something that no one can rule out. And that is why it's sensible to retain some powers. And one of the things I said yesterday, for example, that local authorities will retain their powers at least until the end of September, and before that date we will review them again. So if there's a need for the local use of powers, that is something that can be done promptly. And so it's important, I think, to remain cautious in that way. It's why we will also retain border controls. Your viewers will be familiar with the so-called sort of traffic light system. That will stay in place. There may be some proportionate changes to that. I think the Transport Secretary has already said that we can soon afford to treat people that are double vaccinated travelling to amber countries differently, but that will also provide a degree of protection. And then also there'll be a more proportionate and balanced test and trace system. So I think all of these taken together are there to continue to protect us, especially against the emergence of a new variant. But at all times we will, of course, keep this under review.